this. All right, and then I'm going to share my screen. Okay, so this week we're talking about the Exercise Oncology team and essentially who constitutes the Exercise Oncology team. You know, I think whenever we think of Exercise Oncology, we're thinking, of course, it's going to be exercise professionals. But as you'll see as we go through this webinar today, you know, essentially this Exercise Oncology team is a multidisciplinary team that involves a lot of different disciplines. And so let's dive in. Hold on, let me bring this over. Oh, let me just do this in slideshow. I think that's the easiest way. Okay. So building an appropriate workforce in the field of exercise oncology is really essential for the safe and effective delivery of exercise programs throughout the cancer care continuum. And the reason why this is important is because research reveals that there are many nuanced ways that different cancer types and different treatments and patient characteristics can influence the exercise prescription. And so because of that, a specialized set of skills are going to be required to screen, to assess, to design, to deliver, and to adapt exercise interventions for cancer patients. And so what I wanted to do today for this webinar is to look at the various roles that come into play with this exercise oncology workforce, because you'll see it's not just exercise professionals. You know, ideally, the exercise oncology team is going to be multidisciplinary, and the goal here is to create a continuum of care where open communication exists and triage systems exist, and they're in place so that the patient can receive the very best possible care. And then in addition to that, another thing that I wanted to look.
So that's why all the fruits.
Okay, sorry. In addition, what I wanted to do was look at how we can build this collaborative care model that is going to integrate these disciplines, where each person is going to be functioning at the highest and the best possible use of their specific degree and programming. And then the last thing I wanted to touch on in this particular webinar series, and the reason I'm doing this is because we do have people from all over the globe who are joining this webinar series. And so because of that, you know, if you go from one country to the next, you'll find that exercise oncology is going to differ just a little bit. And recently I co-authored a paper on workforce in exercise oncology with an author from the UK, an author from Germany, a couple other countries, someone from Australia was on there, and we looked at 9 specific countries, and essentially we looked at what is going on in exercise oncology in those particular countries, like what are the nuanced differences there. And so just quickly, I want to take a look at the different models of exercise oncology throughout the world, because again, it's going to differ from one country to the next, and I think that we can really learn a lot by looking at some countries who are doing it well, and then looking at other countries that might, you know, have areas of growth or places where we could potentially help them to grow. So that's what we're going to cover today. There we go. So before we get into all of that, I think it's really important to set the stage as to why this conversation is important and why now is the time to have this conversation. You know, the field of exercise oncology, I personally have been in this field since 2003, and I've shared a little bit about my background, but the field itself has been around for a pretty long time. You know, if you look back at the history of exercise oncology, the first research paper that was ever published in this field was published in 1986. And then since then, there's been more than 32,000 articles that are published on this topic. The reason why I want to bring this up is this is randomized control trials in the field of exercise oncology. So randomized control trials are the top tier level of research. And if you do a quick search on PubMed database right now, you would find more than 3,000 published randomized control trials in the field of exercise oncology. And so that just validates the efficacy of exercise in cancer care. And because we have such a high number of RCT published, that is starting to get the attention of the community. That's really starting to propel exercise oncology to the forefront of many conversations. And we've discussed this before on this webinar series that now in the US, exercise is now part of the standard of care in breast cancer. We're working with the Commission on Cancer to get it to be a part of the standard of care for all tumors. I believe we will be successful on that. We are also working to try to get reimbursement for this. And again, I believe that we're going to be successful on that. And that is due in large part to these randomized controlled trials. When you have the top tier of research saying, hey, exercise is safe and it's effective in patients who are exercising, the medical community can't help but take notice. And so that's really what we're seeing is the medical community is taking notice and seeing the value of exercise for their patients. If you wanted just a quick summary of the documented benefits of exercise, I would point you to the ACSM roundtable papers that were published back in 2019. So in 2019, ACSM published 3 roundtable papers. One of them did a comprehensive review of literature and defined these 8 specific benefits to exercise during cancer treatment. So you can see the citation there for that paper that's listed if you want to go find it yourself. But essentially what this paper did was it combed through all the data that was out there. And it said essentially there is sufficient evidence to show that exercise during cancer treatment will help to mitigate fatigue issues, sleep issues. It will improve quality of life. It will decrease anxiety and depression. It helps patients to maintain an appropriate body composition. It helps maintain function as patients go through treatment. And it also helps to reduce or prevent breast cancer related lymphedema. So it was a really important study because what this did is this kind of just put parameters around these are the tangible benefits of exercise during cancer treatment. There are also a lot of other benefits that are not necessarily listed here. And the reason why they weren't listed here is maybe because at that point in time, this is going back 6 years now, there probably wasn't sufficient evidence to make this claim that these are the documented evidence. And so in this paper, they also go through and say, there's maybe not strong evidence for this, but it's generally believed that exercise can improve muscle strength and muscular endurance and maybe cardiovascular toxicity. So there are a lot of other tangible benefits as well. And because of this, because of all of the research, because we can actually see tangible benefits to exercise and changes that are happening on a molecular level, you've seen endorsements come out for exercise oncology. And, we have just a couple of here on here that I really want to point out because I think it's really important. The first one I want to point out is down here, the second to last one, and these are not in any particular order. But in 2018, the Clinical Oncology Society of Australia, or COSA, they put exercise into standard of care for cancer treatment. So they were the first country in the world to do this. This was a milestone moment. I actually still remember where I was when I saw this article came out. I was sitting in a cheesecake factory doing work. I was having lunch by myself and I was, doing work and checking Facebook, I guess, and I saw this article pop up and I thought, "Oh my gosh, Australia has done it. They've done like what we've been trying to do here in the States." So kudos to them. They led the way with that. America is following in step. We're a couple years behind them, but we have ASCO here, the first organization listed. That's the American Society of Clinical Oncology. They released guidelines on exercise, diet, and weight management in May of 2022. And they issued the strongest statement that ever has been published by a clinical oncology group here in the US that basically said anyone who's treated with curative intent needs to be referred to an exercise program. So it was a very strong statement that got the attention of a lot of people. As I mentioned, exercise is standard of care for breast cancer, and that is here because of the National Accreditation Program for Breast Centers, the NAPBC. They published just last year, January 1st of 2024, new standards that included exercise in 4 different places. And the importance for this for us here in the States is that having exercise now be a part of the standard of care, that helps open the door for things like insurance reimbursement. So when you're trying to get insurance reimbursement, essentially you need to prove two things. You need to show that there's evidence, which we have shown. We have the 3,000 plus randomized controlled trials that validate the safety and efficacy of exercise. So you need to show that. And you also need to show medical necessity. Medical necessity is essentially the NAPBC has now put exercise in their accreditation standards, which means if I'm a breast center and I want to maintain my accreditation, I have to figure out how to offer exercise programs to my patients. I have to assess them for exercise. I have to document it in their EMR that I'm doing this. I have to refer them to an evidence-based program, and I have to measure their functional status. So there are numerous ways that breast centers are now being held accountable for exercise. And the problem now is that this is an unfunded mandate. As long as insurance does not cover this, does not reimburse for this, we're forced to look for solutions outside of insurance to pay for it, which means either patients have to pay for it or hospitals have to pay for it or private donors. There's a lot of different funding mechanisms that you can use, but at the end of the day, this is an unfunded mandate that opens the door for us to then go to Centers for Medicare and Medicaid and say, hey, you know, let's work out a way to get this paid for. And that's exactly what we're doing. We're in step learning, working towards doing that. And I do believe that we will be successful here. There's been a little bit of upheaval with the new transition in our government, but I believe once that settles down, this is something that they're not going to be able to ignore. And the benefits to exercise and now the mandate for it, I think will help us to get there. So what does that mean? That means we need to build a workforce because basically here in the States, we are on a path where potentially by the end of this decade, we can have insurance reimbursement for exercise services for cancer patients. So if you do the math, and this slide here will demonstrate it for you. We have 1.8 million new cancer diagnoses every year in the US. Let's say only 30% of those people exercise. That's just under 600,000 people. That's 30%. That's not even half of the patients exercising. If 30% of those patients exercise, we're looking at about 7.1 million exercise appointments per year. The reason it's 7.1 million is we have requested with CMS, we've requested them to cover 12 exercise visits per patient while they're going through active treatment. So you take 594,000, you multiply it by 12, you get 7.1 million appointments, and that's every year. And now keep in mind, the number of cancer diagnoses are only expected to increase, as we continue through this decade. So this number will probably be even higher once we get to fully funded insurance reimbursement. So doing the math, and when you look at the typical exercise oncology instructor, the full-time instructor, how many patients they're able to see in a given month, we're going to need about 54,000 trained and certified exercise oncology instructors. This is the reason I'm doing this webinar series is because we need to build a workforce. If you're an exercise science student and you're watching this and you're just not really sure like where your place is in the field and maybe considering physical therapy school, maybe considering strength and conditioning, maybe you just don't know, maybe you had a grandfather that had cancer like I did. This is a great field to consider working in because there's going to be funding here where we can pay livable wages, where people can build their careers in exercise science. That is really important to me in particular. I started as an exercise science student. I did want to go on to PT school because I thought that would be kind of my pathway to make more money. And there's absolutely nothing wrong with that. And I know that we have people here that are interested in going to physical therapy school. Well, as you'll see, physical therapists play a very important role in this multidisciplinary team. And right now, we don't have enough oncology trained physical therapists. And so, you, as an undergrad exercise science student, getting certified as an exercise oncology instructor can potentially be a differentiator for you as you apply to physical therapy school or further your education with any kind of graduate degree. So, definitely something to consider. Although I would tell you also consider staying in the field of exercise because that's where my first love is, I guess. So let's look at this workforce then. Who is going to constitute this workforce? As I said, it is not just exercise oncology professionals. I like to show this pyramid here because I think this explains it very well. At the very top, you have the specialists. So we'll talk about what that is here in the States, and in some other countries. We have physiotherapists or physical therapists, and we have physical medicine and rehab doctors. Those are going to be more specialized. And in further slides in this lecture, we'll look at kind of what their roles are and exactly what they do, what their scope of practice is. But they're going to be the top tier. They're essentially, in a well integrated model, they're going to be the ones that assess and triage the patient. And they're going to determine, does this patient have functional limitations where they need to stay with a physical therapist or a PM&R doctor? Or is it safe for them to do supervised exercise training? If it's safe for them to do supervised exercise training while they're in active treatment, then those patients are going to progress down to the next tier that you'll see here, which is the certified exercise oncology instructor. The certified exercise oncology instructor is someone who is basically qualified to work with a patient, provide individualized, supervised exercise training with a patient who is undergoing active cancer treatment. So oftentimes this will take place in a hospital setting. We also at Mapletree have a lot of virtual settings where, patients can exercise in their home. But that is going to be for patients who are in active treatment who don't have those functional limitations that need to be seen by a physical therapist. Then the patient can progress to the bottom tier of this pyramid, which is the community exercise oncology trainer. The community exercise oncology trainer is qualified to work with a cancer survivor who has completed active treatment. And so they still have a unique certification in exercise oncology. They still understand the limitations and the contraindications to someone who has battled cancer because a lot of times the side effects that patients experience don't go away once treatment ends. They still experience fatigue. They still experience limited range of motion. They still experience muscle weakness. And so the community exercise oncology trainer is going to be trained and certified to accommodate for those unique circumstances, but do so in a community setting. So think of a community-based fitness center or a YMCA or, Planet Fitness, those sort of things. Those would be the people that would have the community exercise trainer certification. And in a perfect world, we would have this continuum of interdisciplinary care. And I like to show this because essentially this is what we're trying to create. We're trying to create an open communication flow between the clinical team, between the rehab team, and between the exercise team, where the patient is getting the best use of all of our trainings, all of our degrees, and we have an open flow of communication between each other so that not one person is looked at as a threat or looked at as someone I need to be intimidated to talk to. Exercise professionals have a seat at the table. We just have to understand where at the table we're sitting. Where is our seat at the table? And so, one of the things that's going to help us to define where our seat is at the table is understanding what are the qualifications of this workforce in exercise oncology. And so if you look back at this field of exercise oncology and how the training has kind of evolved to where we are today, you would find that the first formalized training program for working with a cancer population dates back to the early 1990s. That was with the establishment of the Cancer Exercise Specialist Certification, which was offered through the Rocky Mountain Cancer Rehabilitation Institute at the University of Northern Colorado. That's actually my alma mater. I completed my doctoral degree there. I had the opportunity to study under the amazing Dr. Carol Schneider. She's one of the founding women of this field. And she has done so much to progress this field and to train and build up a workforce. So it was a wonderful opportunity I had to train and study under her. And since then, since the establishment of the Cancer Exercise Specialist certification in the early 1990s, this field has seen a proliferation of specialized certifications. So now, if you kind of fast forward to modern day, We have university-based graduate and undergraduate programs. My university, Wright State University, actually offers a certificate program in exercise oncology that is offered not only to our students, but then to any student who's enrolled at an exercise science program in the country. They're able to enroll in this. It's an online program. So that is an option. We also have continuing education opportunities. We have, a couple different exercise oncology certifications that exist. Maple Tree offers one. ACSM has a certificate in exercise oncology that they also offer. And so you're seeing that there are more opportunities to become trained and build up this workforce. If you go back to kind of what are the core competencies that are needed to work in exercise oncology, there was recently a Delphi study that was published that essentially clarified what these core competencies need to be. And when I say core competencies, I'm basically saying if I'm going to be an exercise science professional who is trained and certified to work with an oncology population, what is it that I need to know? How do I need to prescribe exercise and assess a patient with the knowledge that I need to have? And so this Delphi study, the goal of this Delphi study was to create a framework for the standardization of qualifications in the field of exercise oncology. Essentially, what they did was they reached consensus on several core competencies that were grouped into these categories. So they include screening patients and risk stratification, being able to perform a fitness assessment, triaging a patient to the appropriate service and workforce. In other words, does this patient that you're working with need physical therapy, or can they stay in an exercise program? Developing effective and safe evidence-based programs that will be based on the risk stratification and the fitness assessment data that you get. And then delivering the exercise program in a clinical setting and a rehab setting, depending on, where you're working and what that looks like. You can also deliver the program in a community-based setting under, certain circumstances if you have a partner with a fitness center, medical fitness center, and then also delivering the program under the supervision or guidance of an oncology trained health professional. So that would be, obtaining physician clearance for specific exercise programming. Those are the specific qualifications that we're looking for in a workforce. Now, if we're going to look at each of those tiers that I talked about in that pyramid with the different roles, I said at the very top, we're going to have the role of the physical medicine and rehabilitation doctors and the physical therapists. So let's take a little bit of a closer look at to what PM&R physicians do, because it is a relatively new field. They're growing in popularity throughout the country, but essentially, you see PM&R physicians, physical medicine and rehab doctors in Brazil, in Canada, and in the US. And it's a medical specialty. I like to think of the PM&R physician as the quarterbacks on this interdisciplinary team. So they're essentially the ones who are trained to assess patients and determine the correct pathways based on the presence or absence of functional limitations. So cancer physiatrists are trained to help manage treatment-related impairments and manage those really complex cases. And this will help to ensure high-risk patients are safe when they engage in exercise. High-risk patients in this regard would be probably patients that have bone metastases or high levels of pain. Those patients would generally work with a physical medicine doctor. So again, this is an emerging field. There is a continued need for the development of training fields. If you're an undergraduate exercise science student who's considering, pre-med or going to medical school, this might be a career pathway for you where you can still kind of work in the fitness industry field per se, and have a say in exercise programs, but really work with those high risk special populations. Now moving on to the role of the physical therapist or the physiotherapist. Physical therapists are going to play a major role in developing exercise oncology services. PTs use multiple modalities, including exercise, to help people improve or maintain their mobility or function. Physical therapists primarily are going to work out of hospitals, or outpatient or rehab clinics, or in private practice settings, in the community. So if you look at the scope of practice for a physical therapist, this is going to include working with people who have cancer. But the thing that I want to point out here is that most training programs do have minimal education in cancer, which necessitates additional training for competency in working in this field. So in Australia and in the US, they do have specialized credentialing to recognize physical therapists who have demonstrated competence in working with people with cancer. You see this with the APTA, they do have a board certification. I believe Revital Physical Therapy also offers some trainings in exercise oncology for physical therapists. But if you look at the number of trained and certified physical therapists, it's extremely low. The last time I looked, if you look across, the U.S. in particular, we've got more than 300,000 trained physical therapists in the country right now. Of those 300,000, we have about 250 individuals who are credentialed to work with an oncology patient through the APTA's credentialing. So very, very low. So again, if you're an exercise science student who does want to go on to physical therapy school, this is going to be something that can really help to differentiate you from other applicants as you're looking to apply to school. So definitely something to consider. There's a huge need for this workforce for physical therapies. Okay, so now let's move on to the role of the clinical exercise professional. The clinical exercise oncology professional is trained to screen, to assess, to deliver, and to design exercise programs for cancer patients. So most exercise physiologists are going to work in hospitals. We also see them in private practice and community-based programs. In general, a clinical exercise professional will need a 4-year university degree and an additional exercise oncology specific certification. So at Mapletree, one of the options we have is we provide a certification called the Exercise Oncology Instructor Certification. This qualifies individuals to work as clinical exercise oncology professionals. I developed this certification back in 2013 because I work, in addition to running Mapletree, I also work as a professor. And I had a lot of my students, as they graduated, they would work at Mapletree, and I kind of knew what they knew when they graduated, and I knew what they needed to know to work with a cancer population. So that was my initial reason for starting the exercise oncology instructor certification. But as the field has grown, as it's gained momentum, we have, started to offer this more on a widespread basis, just because there is such a huge need to, build the workforce here. And then again, that bottom tier that we have is the role of the community exercise professional. And so a community exercise professional, again, they're going to be someone who is trained to work with a patient who has completed active cancer treatment. So the important thing to keep in mind here is a lot of people who work in community-based settings, such as a YMCA, such as a Planet Fitness, or, that sort of, change it, or community-based fitness centers, they don't always have a 4-year degree in exercise science. And I think we probably all have run into this. But we still need to have individuals who work in community-based fitness centers who are certified and who understand the unique needs of a cancer population. And so we at Mapletree, we've partnered with Livestrong, and I know we're probably all familiar with the Livestrong at the YMCA program. We recently, about a year ago, published with Livestrong to rewrite the curriculum for the Livestrong certification. We now call that the Cancer Fit certification. So it's a brand new certification. We revamped the whole thing. But essentially, the idea here is for someone who does not have a 4-year degree in exercise science, so therefore they would not be qualified to sit for our exercise oncology instructor certification. I don't believe they would be qualified to sit for the ACSM cancer exercise trainer credential that they have. But again, still needing that training, this would qualify that individual without the 4-year degree to still be able to work with a cancer survivor once they have completed active treatment. And this is really important because once you get someone exercising, at Mapletree, 90% of the patients we work with have never exercised before. So we're teaching them how to exercise. We're building that self-efficacy. They're seeing the benefits of this exercise program as they're going through their cancer treatment. We want them to continue on this lifelong trajectory of exercise. We want them to exercise for the rest of their life. So we need places in the community where we can make referrals and trust that I'm referring you to this fitness center, to this particular trainer, because I know they have training with the unique circumstances of a cancer population, and they're going to take good care of you. So this is still a very, very important person in the cancer care continuum. So as we look at the cancer journey, kind of what does this look like? One of the things at Mapletree that we do is we have a phase system that we use to kind of move our patients through as they come to us. So phase 0 is a prehab patient. This is someone at the time of their diagnosis before treatment begins. Usually with these patients, you have just a little bit of time with them. Oftentimes it's enough to get baseline measurements and to kind of start this groundwork for how are you going to stay active and healthy as you go through your cancer treatment journey. So that is the prehab phase. Then they move on to phase 1, which is during active treatment, specifically chemotherapy and radiation. With chemotherapy and radiation, a lot of times this is happening post-surgery, so you might have some range of motion limitations. And then you also have the added desire to protect their immune function. And so usually with someone who's in chemotherapy and radiation, we keep them at a little bit of a lower exercise intensity to protect that. That helps to reduce the number of dose delays and dose reductions that patients get. Then patients move on to phase 3. Phase 3 is someone who is still considered in active treatment, but they've either completed chemotherapy and radiation, or maybe they didn't need it. Maybe they had surgery and immunotherapy, or surgery and hormone treatment. That would be a phase 2 patient. What we're trying to do with a phase 2 patient is build their efficacy, their self-efficacy, so that they can continue exercising once cancer treatment ends in the community setting. So that is when they transition to phase 3, which is the survivorship setting. This is when patients can now exercise in the community with someone who is trained and credentialed to work out with them. So if you're going to take all of the layers of that pyramid that I described, you can see kind of where each role is going to fit on this continuum. So in general, physical therapists can do that phase 0 appointment. The reason why we recommend physical therapists do this is because generally, and right now, remember, exercise professionals don't have insurance reimbursement for this. Physical therapists do. And generally, that baseline appointment is billed at a pretty high rate. And sometimes that can give enough margin for a cancer program to essentially pay for the rest of the exercise program if needed. So if the physical therapists on site are trained and certified in exercise oncology, have that credentialing to work with a cancer patient, and are not too booked. Sometimes physical therapists get so busy that there's like a 6-week waiting list to get in to see them. If that is not the case, if they can get in time, I always recommend have a physical therapist do this appointment. They can screen, they can evaluate, they can get those baseline measurements. They can also triage that patient to determine, are there impairments here that need to be addressed by a physical therapist? If that is the case, then the physical therapist will continue working with that patient into phase 1, that active cancer treatment phase. Now, that patient can also do exercise in parallel with the physical therapy. That is okay. And sometimes it just depends on the patient. Sometimes the patients want to finish their physical therapy before they transition on to exercise, and because they're just overwhelmed with the number of appointments they have per week. Other times patients are like, hey, this is a teachable moment for me. I know I have to make some changes. I want to go to physical therapy and I want to work with my exercise professional just so I get the best bang for my buck and, give myself the best potential outcomes that I possibly can. So sometimes they can work in parallel, sometimes they work in tandem. It really just depends on the patient. Phase 2 then can be completed by an exercise oncology instructor, so a clinically based person on site in the hospital or virtually. And then finally, phase 3 patients are going to be seen by exercise professionals that are working in the community. So the cancer fit trainers would be there. That's how that patient can progress. Now, the one thing that I want to just kind of point out to you is patients can enter this continuum at any point. Sometimes we'll have someone who's 20 years out of treatment and they're just still experiencing fatigue, or they still have range of motion limitations, or they say, I had no idea I should have exercised. Nobody told me. That's because, for a long time, doctors didn't understand the benefits that exercise could have on their patients. And so that patient, they've completed treatment, they would just start as a phase 3 person. Sometimes patients come to us in the middle of chemotherapy because they're just so overwhelmed by their treatment, by the fatigue, by the side effects that they're having, that they're just looking for anything that's going to help them feel better. And so at any point, someone can enter this continuum. And then that's where the individualization comes into play. So you assess that patient, you determine their risk, you look at what are their contraindications, what has the physician cleared them to do? Do they need physical therapy? Can they stay and exercise? What is going to be the best path for that person? Essentially, it's meeting them where they are and then helping them to progress wherever it is that they're starting from. One of the things that we use, because as I kind of alluded to in that last slide, is, Mapletree has 86 clinical partnerships now across the US. And each one looks a little bit different. Sometimes we're working directly with physical therapists. Sometimes there are physical therapists, but there's none of them that are trained in exercise oncology. Sometimes, we do have like a lymphedema specialist, but they're so backlogged that they can't really oftentimes take patients right away. And so if that is the case, then we have a triage system that we utilize that was developed by Dr. Kelly Covington Wood. She is an onco-trained physical therapist in this space. She has developed this form that you see here. This is the Exceeds questionnaire. And so essentially the way that this questionnaire works is it's self-report. So the patient fills this out and you can see there's a red box, there's an orange box, and there's a yellow box. Based on the patient's answers to these questions here, it will determine, does that patient need to be referred to an exercise program, or is it safe for them to do clinical-based exercise program? And so this gives us that triage. Do they need PT or not? We at Mapletree do this across the board at all of our patients that come into Mapletree, fill this out, and then this determines the correct pathway for them. So last October, Kelly and Dr. Wood and I presented on a study where we looked at, about almost 1,000 patients that had taken, had filled out this triage tool at Mapletree and what pathway they went into. And so of the 980 patients who completed this questionnaire, we had 62% of those patients that qualified for exercise training in the clinical setting. So just over half. And then we had 38% of those patients who were qualified for physical therapy. Of those 38%, 14% of them did exercise and physical therapy in tandem with each other. And so you can kind of see the breakdown as to what this looks like in place at on a typical patient population. But this is why open flows of communication between physical therapists and PM&R physicians and exercise professionals are so, so, so important. I think traditionally there used to be some turf wars between the disciplines where I think sometimes exercise professionals were looked at as, are you staying in your lane? Are you performing in your scope of practice? Are you trying to take patients from us? And I think exercise professionals sometimes didn't stay in their lane and, did things beyond their scope of practice. So I think it was warranted. But this triage tool is so great because it clearly delineates when a patient needs to go to physical therapy, when it's okay for them to do exercise training. And that takes away that cloud of suspicion between the two disciplines. And it allows us to work together as colleagues who we're both in it for the same reason. We both want to help the patients to thrive and do the very best they can while they're going through cancer treatment. And so when you have this very clearly delineated path, then you know that you're working in the highest and best use of your degree and the patient is really where they need to be. So I would highly recommend this triage tool. It's the Exceeds, EXCEEDS questionnaire. If you want it, feel free to email me. I'd be happy to send it to you. Now, beyond the physical medicine doctor, the physio, the physical therapist, and the exercise professionals, now we also have many other members that are a part of this multidisciplinary team, as you can imagine. And so I've listed those here, and I wanted to kind of talk through each one quickly, just as they relate to the exercise program. So, in other words, we all know that the role of the oncologist is to help beat cancer. We want the oncologist to work to beat cancer and to help that patient to survive their cancer treatment. As it pertains to exercise, though, the role of the oncologist is very, very important. In fact, at all of our clinical settings we try to identify a physician champion, someone who understands the value of exercise, who's going to advocate for the program, who's going to refer their patients to the program. And so I think it's important to understand what the role the oncologist is going to play then in a clinically based exercise oncology program. So the oncologist should assess the patients for exercise. Whenever they assess the patient for exercise, this just means asking the patient, "Are you exercising?" Or in the last week, how many days or how many minutes of exercise did you get? This is now assessed in some clinical settings as a vital sign. So, you get your height, weight done, you do your blood pressure, and then you're supposed to be asked, "Are you exercising?" Or how many days in the last week did you exercise? So that's what it means to assess the patient for exercise, just simply asking them if they exercise. Based on the answer, then they can refer the patient to the exercise program. And so, my advice to you, if you have an exercise oncology program, or if someday you would like to start an exercise oncology program, is to make that referral process very, very simple. The more complicated it is, the more time it's going to take, the less referrals you're going to get because physicians are already busy. We want this to be easy for them, we want this to be a quick win for them. Oncologists also can provide medical clearance for the exercise prescription. So I think it's really important to keep them in the loop, that they understand what the exercise program is going to look like so that they can say things like, "Don't do any exercises supine, don't lift anything more than 10 pounds." They can provide that clearance. And then that kind of gives you some guardrails that you can work with whenever you're working with that patient. And then ideally, you would get an oncologist who's going to integrate exercise into that overall treatment plan. You really want them to advocate for the exercise program and not to be afraid to talk about it to patients and have that solution for them. Then you have the role of the registered dietitian. And the reason why I included the registered dietitian in here is because oftentimes, if someone's going to meet with a registered dietitian, they're going to be open to the idea of exercise because eating and exercise, they kind of go hand in hand. And so the role of the registered dietitian is going to be really important. Of course, they're going to do the nutrition assessment and counseling, but they can also help to support energy needs that are needed for exercise. So if someone is feeling fatigued, they can help support that with food, but then also with, what kind of exercise are we looking at? Obviously, we don't want to exacerbate the fatigue, but there is so much data that shows, walking can help boost energy levels. And so taking that into consideration, they can help add that into the nutritional counseling that they provide. They can also help manage treatment related nutritional challenges and work with you, the exercise professional, to optimize body composition. One of the things that I don't think a lot of patients are aware of is, traditionally anyway, a lot of times cancer patients have the picture in their head of someone who has cancer who has lost a lot of weight, that cachexic patient where you see the wasting away. And that does happen. There are forms of cancer like pancreatic cancer where you do see significant weight loss that's happened. And there's definitely a lot of nutritional needs that go into that. But what a lot of people don't realize is a lot of the hormone driven cancers, such as estrogen driven breast cancers or prostate cancer, cause the exact opposite. They cause these shifts in body composition where sometimes patients can gain 30 to 40 pounds in the span of like 3 months. And that poses a challenge to the individual because, number one, they're already dealing with body image issues with the breast cancer or with the prostate cancer that they've had, and maybe some surgery that changes, their appearance. But then on top of that, to have the added weight gain, And apparently, like, this type of weight gain that's hormone driven is very stubborn. So think of like menopause related weight gain, how stubborn that can be, or, after you have a baby, that kind of stubborn weight gain that can be difficult to take off. And sometimes people don't realize that that is one of the side effects of treatment. So it completely catches them off guard. And so, working with a registered dietitian and including an exercise program can really help to mitigate that weight gain that often happens with hormone driven cancers. We also see the role of the mental health professional come into play. Obviously, cancer is going to be a time of a lot of distress, a lot of anxiety. Sometimes depression happens because it's like I saw my life going one way and now it's kind of taken this U turn. So, the mental health professional can help add that psychological assessment and that psychological support. They can also work with the exercise professional on behavior change strategies that will help with exercise adherence. I know last year at Maple Tree's end of year retreat that we had for our trainers, we brought in a mental health professional to teach us how to do motivational interviewing. So we could kind of talk to the patients about, what are some of their motivating factors to help them to begin an exercise program and then to adhere to an exercise program once we got it started. The mental health professional can also help with the management of anxiety, depression, body image issues that we just talked about on that last slide, and then support group facilitation. They really can help to facilitate that and just to give patients a safe place to talk. One thing I do want to say, and I see this with Maple Tree a lot, we do individualized exercise training. So it's one-on-one with the trainer, and the trainer and the patient do develop a very close relationship. And I think sometimes the exercise trainer can become that safe place where the patient confides in them and tells them some of the things that they're dealing with. And sometimes that can be really heavy for an exercise professional. They might not know what to say or know how to deal with that. And so having that that line to a mental health professional is just like, hey, I'm talking to my patient. I don't really know what to say. Can I refer them to you or can I have them talk to you? That helps. And then also, we've also used it with our trainers who have lost patients. Cancer is still cancer, and just because someone exercises doesn't mean that they're not going to pass away from that cancer. And sometimes that can be really difficult for our trainers, especially because most of them are really young and they've not really lost someone that they really cared about before. They've never walked through that. And so the mental health professional can really be an ally there as well, and helping the trainer to just walk through some of those feelings that they're having. So definitely seek out a mental health professional and really try to facilitate good communication with that individual. The role of the oncology nurses are so important, and I can't stress this enough. When I first started Maple Tree back in 2011, we really at that time did not have the support of the medical community. A lot of doctors really didn't know the value of exercise. They weren't really, at least the ones that I talked to, were not really willing to engage in conversations about it. So without the oncology nurses really going to bat for me and talking to patients about it and referring them directly into my program, I don't know that Maple Tree would have survived those first couple of years. And so oncology nurses are your friends. They spend so much time with the patients. They develop these relationships and this trust with patients. And they have the opportunity to talk to patients about their symptoms and give them education about it. And like I said, refer into exercise programs. So definitely make friends with your oncology nurses. Oncology nurses also can help to monitor vital signs and the treatment responses. And then they're going to be that communication link between the patient and the medical team. And then finally, they provide that day-to-day support that patients need as they're going through treatment. The occupational therapist, I put these here. In most of our settings, we don't work directly with occupational therapy therapists, but I do know they're a very important component of the rehab team. Oftentimes, we see occupational therapists come into play with helping patients regain functional strength and be able to perform these activities of daily living. They also are very valuable at coming up with adaptive equipment recommendations and then return to work planning. So definitely they're a very vital component of this multidisciplinary team. And then we have the social worker. And the role of the social worker is to really help patients to assess resources, financial assistance sometimes if they need it. We do have social workers that will refer patients into our exercise programs. They can also be a very valuable resource to patients to help them navigate the healthcare system. If you think of someone who's newly diagnosed with cancer and they've never worked in healthcare before, they probably have no idea who to go to for different questions and what to even ask sometimes. And so the social worker can be a very important person to kind of help that patient to navigate where to go and what to do. They also can provide family support and education and connect patients and caregivers to community resources, such as the exercise program. And then finally, we have the role of researchers. Academic researchers are very, very important. You look at the role that they play, they're the reasons why we have more than 32,000 published trials showing the benefits of exercise. So without researchers, we wouldn't have the evidence to be able to make a case for exercise oncology to be not only standard of care, but reimbursed by insurance. So essentially, the role of researchers are to develop those evidence-based exercise protocols that we then can utilize in our clinical settings. They collect and analyze outcomes data, and then they can translate that research into clinical practice. So the reason I started Mapletree was I had done research. My PhD program was in exercise oncology, and I wanted to translate what we had done there in the lab into clinical practice so that anyone who is treated with cancer could have access to an exercise program. So researchers are very, very important to advancing this field of exercise oncology. And then in closing, the last thing that I wanted to do was just to take a look very quickly at exercise oncology programs throughout the world. Now, I want to say before I jump in here, these were the countries that were spotlighted in the workforce paper that I wrote with a team of researchers. So Mapletree itself is working with 25 countries. I'm only going to spotlight 8 countries, and Mapletree's not working with all 8 of them that are being spotlighted. But essentially, what I want to do is kind of give you an idea of, the higher income countries. There's a couple lower to middle income countries here. And you can look to see kind of what is the differences from one country to the next. Who are the professionals that provide this type of exercise training? And what are some of the barriers that they face? Because I think looking at it, on a bigger scale, kind of like top down, it really helps to identify what we can learn from whenever we're looking to incorporate exercise oncology and grow this field, and how can we help other countries to continue to grow this field. Because whether we like it or not, cancer is a global problem. People all over the world are battling cancer. And so how do we make exercise available to anyone who's battling cancer? So, as I mentioned earlier, Australia really is leading the way when it comes to exercise oncology. That is thanks to the COSA statement that was published in 2018 that basically said all healthcare providers need to include exercise as part of routine clinical care for people with cancer. So, this made exercise part of standard of care. They even have insurance reimbursement for, I believe, 5 exercise sessions, which is amazing. I wish we had that here in the US. One day we will. Their primary workforce is an accredited exercise physiologist and a physiotherapist. And some of the barriers that are faced in Australia is there's no standard pathway for referral systems or for the delivery of exercise programs. So Mapletree does work specifically with 2 hospitals in Sydney, Australia. And we have trained and certified 12 exercise oncology instructors to date. But I do know other exercise professionals in Australia who are working in clinical settings who have upwards of 300 patients that they're trying to manage at one time, which is just a huge, huge caseload. And so we are working with them to try to systematize and increase the number of certified professionals in Australia. One thing I thought was really cool, and I want to point this out before I switch to the next slide. This is a picture of me here in front of one of the hospitals. I was at Westmead Hospital there. Now, maple trees don't really exist in Australia. but for some reason, this street out right in front of the hospital was named Maple Tree Road. And it did not have anything to do with my organization, Maple Tree, but I thought it was really cool when I saw that. So anyway, I just wanted to point that out because I thought that was really cool. Okay, exercise oncology in Brazil. We personally have been working with professionals in Brazil since 2019 to bring exercise oncology to this country. The Brazilian Society of Clinical Oncology has made a recommendation for physical activity during and after cancer treatment. So that's a definite positive there. Their primary workforce includes physiotherapists, PM&R physicians, and physical therapists, and the physical education professional, which is our equivalent of an exercise oncology professional. Now, some of the barriers that they run into in Brazil is a lack of funding and government support, and then this formal recognition and the training of professionals who are in oncology care. So we're working with them to try to improve that. We do have 5 Maple Tree sites that are running in Brazil right now. One of them is a pediatric cancer site called Maple Kids, and they also have 12 trained and certified exercise oncology instructors. And this woman here in the green, her name is Alice Francisco. She is a breast surgeon who, her story is really unique because she was battling, I think it was thyroid cancer many, many years ago in Brazil. And her oncologist told her to exercise. And I think his exact words to her were, if you want to live, you need to exercise. And so that's what turned her on to the field of exercise oncology. She actually found me on Instagram. So she's one of those people that you meet on the internet that actually turned out to be a really good thing. But she has worked so tirelessly to make this dream a reality in Brazil. We also have exercise oncology in China. So the Chinese Society of Nutritional Oncology and the China Anti-Cancer Association and the National Health Commission has prioritized exercise oncology as one of their domains that they want to focus on. The workforce in China is primarily a exercise physiologist and a physical therapist. And the barriers right now are an insufficient number of trained professionals. Now, Mapletree is working with China through Exercise is Medicine in Beijing, and we have been able to train and certify 45 exercise oncology professionals. We're also working with them to establish licensed health partners as hospitals there, so that there can be more of a workflow with patients into exercise programs. Exercise oncology in South Africa. Now, South Africa would be an example of like a lower to middle income country. But what is so, I think, amazing is that there is so much work that is being done to try to bring exercise oncology to this country. So primarily what we have in South Africa are physiotherapists, biokineticists, which is it's kind of like an exercise science professional, but they are reimbursed by insurance, which is really cool, as are physiotherapists. They also have exercise physiologists and sports physicians. Some of the barriers in South Africa are there's no clear patient pathway into an exercise program or formal organizational structures. So we are working right now with a gentleman by the name of Dr. Pilar in South Africa to try to systematize this and make it more possible for people to become credentialed. My husband and I went there last fall and did a workshop to train and certify exercise oncology instructors there. Then we have exercise oncology in Canada, and the Cancer Care Ontario has formalized guidelines for exercise oncology. Their workforce primarily includes clinical exercise physiologists, registered kinesiologists, physiotherapists, PM&R physicians, and fitness instructors. So they have a very robust workforce in exercise oncology in Canada. Mapletree is not working directly with anyone in Canada, but I would love to because, as you can imagine, the maple leaf and Mapletree to me seems like a really good fit. We have Exercise Oncology in Germany. They have guideline development in process. So it is not yet published yet. They expect that it will be published in 2026, which is really exciting because in 2026 in Germany, we will be holding our very first International Society of Exercise Oncology conference, and that will be in Germany. So hopefully those will line up and we'll have some guidelines developed for Germany when that happens. It's expected that this workforce will include physiotherapists, sports scientists, and then qualified fitness professionals. And some of the barriers that they're running into right now are the consolidation of training concepts that are taking place right now under the German Association for Health and Sports Therapy. And then finally, exercise oncology in the United Kingdom. You have the National Institutes for Health Research, Cancer, and Nutrition Collaboration, which has helped to set principles and guidelines for cancer prehabilitation. So, prehab is very big there. The workforce primarily is the clinical exercise physiologist, the physiotherapist, and cancer qualified fitness trainers, very similar to what we see here in the US. And then the clinical exercise physiologist can work in a range of cancer settings, anything from exercise prescription to the delivery of exercise interventions. If you're wanting more additional resources, I just kind of wanted to share these with you because I thought they would be really valuable. There was recently in the fall a new textbook in exercise oncology that was printed by Dr. Catherine Schmidt, who's actually our chief scientist of Mapletree, Anna Campbell, who is the author of the CAN Rehab certification, and then Anna Schwartz. This book is great. I've read it cover to cover, but it's very good at giving some modules and clinical exercise prescription guidance and credentialing. So I would recommend that book. And then just as a little plug, I kind of mentioned this, we had our first planning meeting of the International Society of Exercise Oncology. We had our planning meeting in May before the ACSM conference last year. And then we're going to have our first official conference meeting in Germany next year in 2026. So something to look forward to if you're looking for a way to get more involved with exercise oncology on an international level. I would highly recommend becoming involved in this society. If you are interested in getting certified as an exercise oncology instructor through Mapletree, I wanted to present this option to you. We are offering it at a 20% discount to anyone who's involved in sitting through this webinar. So feel free to scan that to register and you'll get 20% off if you use that EO Team coupon code. If you want to register for the Cancer Fit certification, now remember the Cancer Fit certification is for people who do not have a 4-year degree. If you are currently in a 4-year degree program in exercise science, you can still sit for the EOI certification. But if you do not have a degree in exercise science and you're not enrolled in a program and you want to sit for the Cancer Fit certification, you can scan this QR code to register for that. And that is the end of our show. Let me stop sharing and let me stop recording.